Were you aware of studies showing that myocarditis was also a real risk factor from COVID?
There were studies saying that. As time's gone on, it's become clearer and clearer that this notion that COVID is more of a cause of myocarditis and it's more severe is frankly rubbish.
First and foremost, there's been a lot of debate about whether COVID increased myocarditis itself. And the totality of the evidence, I'm sure Peter will agree with me, doesn't suggest that compared to any other viruses, it's particularly more prevalent.
Studies showing that myocarditis was also a real risk factor from COVID.
Now, myocarditis on the inpatient studies is a problem because it's not adjudicated. And a blood test is commonly done in almost all hospitalized patients called troponin. Troponin is the most abundant protein in the human heart, and it's a reliable indicator of heart damage. But a troponin being elevated in COVID-19 respiratory illness doesn't establish a diagnosis of myocarditis because it's elevated in bacterial sepsis and other ICU conditions. So, the literature, and there's some papers written on this, that say COVID-19 itself causes more myocarditis than the vaccine. Those papers are not valid because they're not adjudicated cases of hospitalized patients developing myocarditis. But was of interest in community outpatients, the Big Ten had a screening program, a paper by Daniels and colleagues published in JAMA, looked for myocarditis in thousands of athletes. 30% of them got COVID. They found a handful of cases that would have met a definition by multiple testing. And then a paper by Joy and colleagues did very prospective cohorts, detailed screening of patients who developed COVID, no evidence of heart injury.
Studies showing that myocarditis was also a real risk factor from COVID.
I think it's really clear that this is a risk of the vaccine, but what is also clear from the data is that the risk for these young men is much higher from the virus again. And so we've got data out of Israel that shows that it's significantly higher.
There's another point, this is a nuance, I want to get this out. There is basically misleading paper in the New England Journal of Medicine that says that if one gets COVID, the respiratory illness, they're more likely to get myocarditis than take a vaccine. There is almost a fraudulent scheme to this. This New England Journal of Medicine paper said that myocarditis more likely in those with COVID-19 than with the vaccine. What we know is that someone sick enough to be in the hospital who's in the ICU can have a small rise in troponin. That's the blood test indicating cardiac injury. But half the people in the ICU have that anyway, from pneumococcal pneumonia, staph, sepsis, etc. It's just part of being in the ICU, okay? The Chinese never called that myocarditis. They called that cardiac injury with COVID. The Chinese were right. It's just a troponin elevation. That's it. It's largely inconsequential. We don't do anything about it. That's very different than the explosive chest pain, early heart failure, EKG, and massive troponin rises we see with vaccine-induced myocarditis. They are two completely separate syndromes. What the New England Journal of Medicine paper is, they just use the numbers. If you have lots of adults being admitted to the ICU, you're going to have big numbers of people who have a trivial rise in troponin that's inconsequential. That's different than myocarditis after the vaccine, which has a lower occurrence rate.
If you look at some of the communications, it's clear that people were claiming that, myocarditis, it's very rare.
It's very, very rare.
This is a very rare side effect.
And people were also saying, you're more risk of myocarditis if you actually have COVID than if you have the vaccine.
The risk of myocarditis after the vaccine is a lot lower than risk of myocarditis after being infected with COVID-19.
If you've got the disease, you can also get myocarditis, and it will be much worse. It can be very severe.
Yes, there is a small risk associated with being vaccinated, but the rates of serious illness and death associated with actually getting COVID-19 are much, much higher.
Any small risk associated with the vaccine is by far outweighed by the risk of getting COVID-19.
It is extremely rare internationally, and the risks of getting COVID, which itself can cause myocarditis, as the Minister has said, certainly outweigh that.
Both of these things were wrong. There was a very good study done in Israel. It's called The Incidence of Myocarditis and Pericarditis in Post-COVID-19 Unvaccinated Patients. a large population-based study. The conclusion says we did not observe an increased incidence of pericarditis or myocarditis in adult patients recovered from COVID-19.
Studies showing that myocarditis was also a real risk factor from COVID.
Large literature reviews, narrative reviews, assessments of the broader landscape, and the real-world experience of doctors all around the world, including here in New Zealand, which, as I know, all you can look at, would actually say otherwise. And of course, we've included plenty of evidence in our written statement to you.
Well, yes, and I did an OIA because I was curious about that very question about, we were told that myocarditis was more severe in COVID than post-vaccination. So I asked the Ministry of Health, well, how many cases of myocarditis due to COVID infection have they been? Well, they couldn't provide me with a single case, and yet there were 900 plus cases of myo and pericarditis on the CALM Safety Report 46. November 2022. So
I don't want to get into all the detail of all your submissions, but your request for it was of cases of people with COVID and myocarditis in hospital, wasn't it?
Well, myocarditis is a fairly severe disease, and most people who are properly diagnosed will likely spend some time in hospital.
Yes, but your Official Information Act request was of people with a COVID-19, was with COVID-19 and myocarditis, wasn't it?
Well, yes. I mean, it doesn't say there weren't any, but there certainly weren't vast numbers of them if they couldn't sort of identify a single one for me, as opposed to the 900 cases following the vaccine reported to MedSafe in the first 2 years.
Right.
And I mean, it depends how you diagnose myocarditis. Is it just a transient troponin rise in an acutely sick person?
It's just a troponin elevation. That's it. It's largely inconsequential.
Or have you got an ECG with changes, an echocardiogram with changes, an MRI with changes?
I don't want anybody to think that the myocarditis of the natural infection is anything like what we're seeing with the vaccines.
Exactly. The vaccine produces the inflammatory type process on the heart.
And the vaccine is directly there. Now there's preclinical studies suggesting the lipid nanoparticles actually go right into the heart. The heart expresses the spike protein. The body attacks the heart. There are dramatic EKG changes. The troponin, the blood test for heart injury with the vaccine myocarditis is 10 to 100 folds higher than the troponin we see with the natural infection. It's a totally different syndrome.